Good morning, everyone. We are now ready to discuss about atherosclerosis. This is very important topic in blood vessel. In this PowerPoint, first we will see blood vessels structural component. There are three layers in the blood vessels: intima, media, adventitia. The media is thicker in arteries, but adventitia is more thicker than media in the veins. And these things we will see in microscopic diagram after this slide. There is innermost layer of the blood vessels is endothelium. After that there is internal elastic lamina. After that there is extracellular matrix, which is having elastin, collagen, mucopolysaccharides and other smooth muscles component, connective tissue and fat. Now we will see microscopic finding. This is the first diagram, which is showing there is thickness of medial layer, which is more than the other parts of the blood vessels like intima and adventitia. In this diagram, the innermost endothelial layer is very clearly visible and having. After that there is thickened media having that smooth muscles as well as other connective tissue. In this diagram, this is artery and the flattened structure is the vein. The artery is having thicker media as compared to the adventitia, but the finding is different in vein, which is vice versa. And due to that, the veins most of the time flattened. And the last microscopic structure is the capillaries, which are having only the endothelium, unicellular thickness of endothelium. After knowing the structure of blood vessels, now we will proceed further. Most of us may be known or unknown about the term arteriosclerosis. Arteriosclerosis means hardness of arteries. There are a few causes for that, and the most common cause of hardening of the artery is atherosclerosis. After that there is the second cause is calcification of the medial wall of the artery, that is called as Mockenberg's medial calcification. And the last cause of arteriosclerosis or hardening of artery is arteriolosclerosis. Arteriolosclerosis, that term is most of the time used for the changes in the blood vessels of the kidney in the patient of having hypertension or diabetes. As about any other disease, in pathology we read or try to know about the natural history, then epidemiology of the disease, then risk factors, factors which increase or decrease that disease, then pathogenesis. In pathogenesis we see what are the changes at the cellular as well as tissue level. Then due to that pathogenesis, what are the clinical expression of the disease, and the last, what are the prevention, how to prevent that disease to progress, that we can decrease the morbidity or mortality of the patient. First we will discuss about the natural history, how this atherosclerosis progresses. Right now it has about 6 type of lesions in their progression, and in short we can tell in three steps only: fatty streak formation, atheroma, and thrombus formation. The initial lesion of the blood vessels in the endothelium causes accumulation of macrophages at the site of lesion. After that, due to the accumulation of monocytes in macrophages at the site of lesion, they engulf the lipids available in the blood vessels, and all those monocytes at the site of lesion, they produce a non-palpable visible yellow streaks. Those are called as fatty streaks. As the time passes, there is also accumulation of extracellular lipid pools, and that lead to atheroma formation in the intimal area. As the time passes, there is calcification or fibrotic changes, and all the changes, calcification, fibrotic changes, and thickness of the intimal layer, it is due to migration of smooth muscle cell from medial layer to the intimal layer. As the smooth muscle cells migrate from medial to intima, they reaches at intimal site, and where they start proliferation, that proliferation led atheroma formation, and ultimately that atheroma formation, which is palpable, it increases turbulence in the blood vessels, and as the turbulence increases, the injury also increases, and as the injury increases, there is addition of the platelet takes place, and ultimately thrombus formation also occurs. And thrombus formation, which is very dangerous because it can cause ischemia as well as infarction of the tissue. Whatever we have discussed in the previous slide, here we discuss it again. First I started from the normal artery. Normal artery of the lesion, there is fatty streak formation, which is non-palpable form of the lesion, and after that fibrofatty plaque formation, then then advanced, as the plaque advances by deposition of lipids, that can lead to the clinical phase, and these are the complications of the advanced vulnerable plaque formation. The first one is aneurysm and rupture, the second one is occlusion by thrombus formation, the last one is critical stenosis. These are morphologic concepts, whatever we have discussed. We can go once again. At the site of lesion, macrophages will come. After that, macrophages or monocytes migrate inside and infiltrate inside the intima. Due to that, there is intimal thickening. Lipid is accumulated at that place, ultimately is changed into the fatty streak. As the fatty streak progresses due to accumulation of macrophages, smooth muscles, atheroma, there is growth in atheroma, and smooth muscles hyperplasia occurs, size increases day by day, and fibrosis, calcification also takes place at the same site, and ultimately at the advanced stages, there is calcification, aneurysm, and thrombosis. Here a few pictures. The first one is from aorta. Here is some arteries which are arise from the aorta, and where the place where the arteries are arise from the aorta, due to sudden turbulence or change in the direction of the blood. Endothelial injury takes place spontaneously, and these injuries are cause of fatty streak formation. In these microscopic findings, the uppermost top layer is made up of the macrophages, foamy macrophages. In this gross diagram, the advanced as well as the mild stage of the atherosclerosis. In mild stages and advanced stages there is difference. In the advanced stages there is calcification, thrombosis, all these are visible in the this dark area or calcification. Once again the same thing, the same advanced feature of the atherosclerosis. Then epidemiology and risk factors. The development of the nations related to this atherosclerosis. Most of the developed nations have highest number of these cases, but as the awareness and dietary restriction takes place, the number of cases and mortality also decreases. The other risk factors are the age, sex. In sex, male are more prone for the disease, and in the females, estrogen plays very protective role. Genetics also plays a role. And the other risk factors for the atherosclerosis are we will divide in two parts, major and minor. And in major and minor, again we will divide it in two parts, non-modifiable and modifiable. The modifiable part of the major are very important, because these four factors are modifiable, mean if we can change these things, the risk for the atherosclerosis will decrease. And why? Because hyperlipidemia, hypertension and diabetes, all these are treatable factors. And cigarette smoking is also a behavioral change. If we have any behavioral change, we can decrease the risk of the atherosclerosis. These are the major factors, and the major factors are all the modifiable one, because non-modifiable we can't change. We can't change the sex, we can't change the genetic. So these are the area, the modifiable one, which are very important for pathology. And the first major factor is hyperlipidemia. It is due to intake of more cholesterol, but in cholesterol the unsaturated fatty acids are good. Omega-3 fatty acid, which are mainly available in fish, are also good. Exercise is also good. HDL is a good lipid which mobilizes cholesterol from atheroma to liver. This is microscopic diagram which is showing foamy macrophages, the paler area. The next diagram, next microscopic finding is the cholesterol. All these needle-like structure are cholesterol clefts. The other non-major factors are homocystinuria. At least we know about this, and related to low B6, vitamin B6 and folate intake. The next non-major factors are coagulation defect, lipoprotein, then inadequate exercise, type A personality, obesity, alcohol. Pathogenesis, again this is the repeat of whatever we have seen in the previous slide, again in diagrammatic form. Here are the normal blood vessels. After injury there is accumulation of monocyte at the site, monocyte they engulf lipids and then it's entered inside the intima. In the intima there is also migration of the smooth muscles from media. All they accumulated in intimal layer, and proliferation of the smooth muscles takes place due to release of some cytokines, and ultimately there is atheroma and plaque formation takes place. These are the main four component of pathogenesis: endothelial injury, inflammation, lipid, smooth muscle cell. Again, the diagrammatic representation of atherosclerosis: monocyte insert come at site of injury and then entered inside the intima. In intimal layer, the macrophages engulf